Do you have to have your wisdom teeth removed? The answer in this country is no. We have the NICE guidelines here, which is a set of guidelines which tell us when we can and can't remove wisdom teeth. Essentially, if your wisdom teeth are coming through and they're perfectly healthy, there is nothing wrong with them, they don't cause you any pain, then really you don't have to have them taken out unless they are causing you problems. It tends to be that we only take wisdom teeth out when they are causing you problems, or if you need jaw surgery for any reason and they're in the way of that jaw surgery. So according to the NICE guidelines, you should leave healthy wisdom teeth in place unless you have a problem such as they are decayed, you have repeated abscesses, get periodontal pockets around them, they're in the way of a jaw surgery, or there is a certain problem with the tooth that then it needs to have an extraction done. People have different opinions on this across the world. So in some countries, they tend to take out wisdom teeth prophylactically. They used to do that in this country as well, because they may have risks or problems with wisdom teeth later on in life. Certainly there are actual risks with taking a wisdom teeth out as well. Sometimes the wisdom teeth, where they're so far back in your jaw, the roots of the wisdom teeth can be close to something called the ID nerve, where in taking the wisdom teeth out, if the roots of the tooth then knock against the nerve or are in the way of the nerve or damage the nerve, you can get long-term numbness or altered sensation of the areas where that nerve supplies, which can be your lip, tongue, chin area as well. This only happens permanent numbness only happens in 2% of cases, so it is very, very low, but we try not to take any risks. So we would only take a wisdom tooth out if it is indicated, if there is actually a problem with it. But if there are no problems with wisdom teeth, then we tend to leave them in situ. If there are transial problems, things like problems with the gum around it, where there's a flap of skin on it while it's coming out, then we tend to treat it as and when. So for example, when your wisdom tooth is coming through and you get food trapping underneath the gum and it's sore for a little while, then we would tend to clean out underneath that gum, or maybe cut that little bit of gum away so it's more comfortable for you, and then we tend to leave the wisdom teeth in place and they tend to become symptom free and come through. But if you have a longer term problem, for example, if you have decay in that wisdom tooth, or you have an abscess around it, or you get repeated infections around that tooth, that would then be an indication to take that wisdom tooth out.